evening, Dr. Ita. My name is Kaheng from Group 3. Today, our group would like to present a topic which is the disease cyanosis, or known as blue baby disease. In this video, we will begin with doing an analysis related to the movie called Something the Lord Made. Then, secondly, we will shortly discuss the general view of the disease known as cyanosis. Thirdly, we will go through the biomedical device used in the movie and also the current biomedical device that used to aid in the surgical procedure to cure the disease. Lastly, we will make a conclusion on our finding of this case study. Before we continue our presentation, let me introduce my group member first. My group member names and their respective metric number are displayed on the slide. Now, we will start the introduction by my friend Shah.
I'm Sharari Samsuri, and I will be presenting the introduction to the movie as well as the disease. So, the movie we got was Something the Lord Made. Embarking on the cinematic journey of Something the Lord Made offers a compelling glimpse into the intricate world of healthcare and medical challenges. It actually began in Nashville in 1930 during the Depression era. So, as the story unfolds, Dr. Alfred Blaylock, along with Vivian Thomas, work together to tackle congenital heart defect, tetralogy of Fallot, which then leads to the development of the Blaylock-Thomas thoracic shunt, which is a procedure to increase blood flow to the lungs in some form of congenital heart disease. Next is the blue baby syndrome, which is cyanosis. Cyanosis is the discoloring of the skin and mucous membrane due to blood oxygen level, which is causing the skin to appear more bluish. Um, so, congenital heart defect disease refers to the structural or functional abnormalities of the heart that occurs during fetal development. And there are many types of CHDs. Some of them are tetralogy of Fallot, transposition of great arteries, and heart valve deflection.
I am Nur Ain Mawadah binti Hamzah, and I will discuss about medical device used in the movie. The medical device used in the movie is BT shunt. It is temporary surgical procedure for congenital heart defects in pediatric patients. This procedure creates a connection between systemic circulation and pulmonary artery to enhance blood flow to the lungs. This procedure is usually performed in the first week of life, where it sacrifices the subclavian artery to prevent kinking of the artery. Originally, it only included autogenous leaf tissue. It was hoped that the shunt would grow with the patient. However, there are complications like the scar tissue and the anastomosis may limit growth, leading to overshunting, nerve injury, and poor limb perfusion. Therefore, the modified BT shunts often use graft-like expanded cortex to overcome growth limitation. While the BT shunt serves as a palliative solution, it does have its limitation. Risks associated with this procedure include thrombosis, pulmonary overcirculation, shunt obstruction, incomplete oxygenation, growth-related issue, and surgery risk. Regular medical monitoring and follow-up are crucial for early detection and intervention to manage these potential complications. Survival rate of blue baby patients decrease when their age increase. This is because young infants have better adaptability to change in blood flow and oxygenation, and pulmonary vascular resistance is higher. So, as the baby grows, the pulmonary vascular resistance naturally decreases, and the shunt may become less effective in improving blood flow.
Now, I will talk about the current biomedical device, which is the cardiopulmonary bypass machine that used to aid in the surgical procedure to cure the blue baby disease. Cardiopulmonary bypass is a technique used in the cardiac surgery, including procedure to address the congenital heart defects such as blue baby disease or cyanotic heart disease. It is a procedure that directs blood circulation away from the heart and lungs and drain it into a machine outside of the body. The machine used in the procedure is the cardiopulmonary bypass machine, also known as the heart-lung machine. It temporarily takes over the job of the heart and lungs by providing oxygen into the blood, removing carbon dioxide from the blood, and then pump it back into the circulatory system. This machine is most often used during surgery to stop the patient's heart without harming them, such as an open heart surgery. Now my friend Rayan will take over for the subsequent part, which is the functionality and the suitability of this cardiopulmonary bypass machine.
Now I, Rayan, will be discussing about the functionality and suitability of cardiopulmonary bypass (CPB) as well as its limitation. In normal circulation, the oxygenated blood travels through the right atrium into the right ventricle and pumped into the pulmonary system, ultimately reaching the left atrium and ventricle before being pumped to the body tissues through the aorta. Now for the cardiopulmonary bypass circuit, it is initiated at the right atrium, drawing the oxygenated blood into a reservoir. From there, a centrifugal pump takes over. It mimics the heart's function during cardiac surgery, propelling blood into the oxygenator for gaseous exchange. The oxygenated blood then returns to the patient's heart through the aorta. And now for the function of component. The component of CPB includes a reservoir, which manages chemical electrolyte content of the blood, a centrifugal pump that circulates blood through the circuit, replacing the heart's function during cardiac surgery, an oxygenator that introduces oxygen into the blood and removes carbon dioxide, which effectively replacing the lungs' function, and heat exchanger that regulates the blood temperature before returning it to the patient's heart, and last but not least, a atrial line filter that removes inflammatory mediators and excessive fluid while controlling hemodilution. And for CPB to function, it requires initiation. Initiating CPB involves cardioplegia, temporarily stopping the heart electrochemically, and administrating anticoagulant to prevent blood coagulation within the machine. At the end of the cardiac surgery, weaning is required. Weaning from CPB involves gradually withdrawing external support that assists the circulation. This includes rewarming the heart to create optimal condition for the heart to beat, an intervention like electrical defibrillator or pacemaker to re-establish cardiac myocyte metabolism. However, CPB is not without its challenges. It induces systemic inflammatory response syndrome (SRIS) due to the body's exaggerated response to foreign surface of the tubing. This triggers inflammatory and coagulation reaction. Additionally, CPB produces a non-pulsatile flow, disturbing microcirculatory flow and impacting effective nutrient and oxygen exchange in tiny blood vessels.
I would like to discuss the ways to improve the function of the CPB. Researchers and medical professionals are actively looking for ways to reduce the immunological impact of the cardiopulmonary bypass circuit to solve this issue. The circuit component's biocompatible coatings aims to lessen the inflammatory reaction. PVC is the most commonly used material for the production of CPB machine tubing. It is suitable to be used as a circuit tubing as it is both rigid and flexible at the same time. Secondly, developing a pulsatile pump and incorporating it into the CPB circuit is also one strategy that could be effective to address the problems associated with the non-pulsatile flow during CPB. Thus, this is the end of the body content. I will hand over the presentation to my friend Jiaoya to make a conclusion about the topic that we discussed today.
Hi, my name is Zhaoya, and I would like to introduce you to the conclusion that I'm responsible for. First of all, the entire assignment deals with a disease called blue baby syndrome, also known as cyanosis infant disorder. The disease can be treated in two different methods, namely blind lactato shunt and cardiopulmonary bypass, but the former treatment is only temporary until doctors find the right treatment. So regarding the medical device for this disease, we focus on the CPB machine, whose main function is weaning and the initiation. This machine plays an important role in surgery, but it also comes with two main limitations, but for its limitations, the medical community has found a way to ease it, and with the progress of medical technology, the probability of cure for blue baby syndrome has also been greatly improved. We can see that more than 90% of patients are still alive 20 years after the initial surgery, so people can hope for a complete cure of this disease in the future. That's my conclusion. Thank you.